NTV. Once again, thank you so much for joining us. Morning at NTV is the hashtag on Twitter, and you can definitely go on with your phone because your phone goes all the way to the bathroom. Even in your bed, you are having your phone, and so you have the opportunity to stream this morning's program as you continue on both on Facebook as well as NTV. My name is Priscilla Regina Neloga. Now in our Tech Note, we're going to be looking at autism prevalence in developing countries. Of course, Uganda being one of the developing countries, autistic people are often subjected to stigma and discrimination, including unjust deprivation of healthcare, education, and opportunities to engage as well as participate in other communities. Now, according to UBOS, the prevalence of autism stands at an estimated 88 people per every 10,000 persons in the Ugandan population. The central region alone has the highest number of autistic persons in the country, with 106,749 cases, followed by the eastern region with 101,334 cases as per last year. Now, we do have Dr. Francisca, a medical practitioner, as well as Pamela Titi. They're going to be giving us a better understanding of autism, because honestly, where we stand today, it seems like now every family has an autistic child, and they have to deal with that child. But at what point do they get to discover that this child is autistic? It's usually when they've gotten to that point where they need to start speaking, but the child is not speaking. They need to start communicating, but they're not expressive, and then parents get concerned, and then the communities will tell them, no, each child takes their own time, so give it time. But by the time they get this diagnosis, perhaps it's too late. But I do have experts with me. Good morning to you, doctor.
Good morning, Priscilla.
You're most welcome.
It's a pleasure to be here. Thank you for having us.
Okay.
My name is Dr. Francisca Rocha. I am a pediatrician and pediatric neurologist at Mass General Hospital in Boston. And I'm here with Pamela Titi, who guides the Tunavisa Children's Center. And our goal is to further awareness and education on autism.
Okay, all right. Good morning to you, Pamela.
Good morning, Priscilla. I'm Pamela Titi. I'm the CEO of Tunavisa Children's Center. It's a center for children with special needs. So we offer rehabilitation services to children who need, so not only autistic children, but children with different disabilities, and may I say different needs together. Yeah.
All right, let's start with the medical element of this autism. Is it a disease, first of all, or it's a condition, or it's a syndrome? And what is it in general?
Very good question. So we understand autism as a neurodevelopmental condition. It is not a communicable disease, but we understand autism as a condition that is likely has many factors that play a role, like genetics, environmental factors, possibly the way the brain is developing and wired may be different in children with autism. And how do children with autism present? They have very striking challenges in social communication, and often rigid and repetitive behaviors. These are some of the main clinical features that we see in children with autism.
Okay, and when it comes to causes, what would you say causes autism if it's a condition?
Yeah. So there is a lot of research into the causes of autism. What we know is that we think it's a multifactorial. So there are three big buckets that we think play a role into the development of autism. One is genetics. There is often a strong family history in families who have children with autism. And it's nothing that the family can influence. This is just a variation in the genetic makeup that we think may play a role in the development of autism. And then there is likely a change in how the brain develops, in the sense of that the structures are there and fully functioning, but the way the areas of the brain communicate with each other, we see on imaging findings that it's not the same in comparison to normally developing children or neurotypical children.
Okay. Yeah. Pamela, what inspired you to actually get into a place of saying, let me offer help, rehabilitation help to children with autism?
Actually, what inspired me had nothing to do with autism. I had a child who had brain damage at birth, and we did not have facilities to actually take care of such children because they needed special special help like consistent physiotherapy, occupational therapy, speech and language therapy, because when she was born, the left side of the brain was damaged, and that part could have affected her movement, her speech, and her general development, especially the intellectual bit of it. So this, I traveled quite a lot trying to find help, and it was very difficult until I decided to do it here. So I met a few friends of mine in the States who helped me set up the center, guided me. By the way, I'm a lawyer by profession.
Okay.
So I'm not a doctor, but you know, there's no better doctor like a mother. So I had to get friends like her and many others who came here and helped me set up a center that would take care of all the children, not necessarily children with autism. But as we started growing and becoming bigger, we started getting more numbers of children on the spectrum and many other developmental delays. So what inspired me was really that we didn't have these services here, and my daughter needed the services, and so.
And what's the age bracket that is catered to the services that you offer?
So we see children who are newborns to about 14 years of age. However, the majority are ranging between 4 and 11, because most of them, parents actually start realizing that they need help when they are of school going age. When they start, like, they don't meet some milestones, especially school going age, like kindergarten and maybe primary 1, that's when they start realizing that actually the child needs help, and that's when they come. So that's the biggest number. But otherwise, we also have children, newborns, who go for physiotherapy and occupational therapy as.
Okay, Dr. Francisca, this is where it speaks into diagnosis. At what point ought a parent have this diagnosis? Because you've talked about genetics, and maybe it could be the case of like sickle cells. Do couples have to first go for testing, genetic testing, to be able to see compatibility? Is it prone to creating autism within the family line? And then when children are given birth to, at what point ought they to just have checks and balances so as to detect early autism?
Yeah, excellent question again. Regarding the you know, is there available testing for parents who are planning to get pregnant? There is no test that we can do during pregnancy, or a specific diagnostic test to evaluate the risk for developing, you know, a child developing autism. We know, however, if there's a family history, that there might be an increased risk of a child, another child developing autism as well. And regarding the question of whether when to diagnose autism, you know, our goal is to raise awareness about autism, and to also teach and educate on how to diagnose.
What's the earliest indicator?
The earliest indicator is loss of milestones. So autism can be detected as early as 18 months of age. That is often very challenging. The main age bracket when most patients get detected and diagnosed with autism is age 3 years and up. And the main factors that we look for are difficulties with social communication, and that can be just not hitting the language milestone. So a child that does not have adequate speech-language development is not speaking words at a certain point in time, and certain repetitive behaviors that allow us to make an early diagnosis.
Okay, Pamela, from the institute that you have, what other resources available that you are using to actually aid children with this kind of condition?
So what happens is that most of these children go see doctors when they are not meeting their milestones. So then the doctors tend to refer them to us, so we do assessments, and we use the medical assessments to find out whether the child is either on the spectrum or not. But nonetheless, we encourage parents to actually do their monthly, you know, the weekly test or monthly test to go and see after birth. What happens is that most parents, after they give birth and it's a normal delivery, that's it, they go home. And they don't realize that some things you can see early. I know you can detect eye contact of a baby when she's still breastfeeding at 9 months. You should be able to breastfeed eye to eye, and the contact is good. If you don't see that eye contact, then there's a social skill that is social communication that is not happening. Those are some of the signs that you look at, and these are the things that you should be seeing with your doctor often, like at 4 months, have you gone for your routine check? At 6 months, is the baby sitting? Are you meeting the developmental milestones? These are the general developmental milestones. And it's not only for autism, because even children with delayed development in some areas, you can tell at 3 months, 4 months, when the baby is not giving you the social smile. You can tell at 6 months when the baby can't, you know, sit upright in a chair or something. Yeah. So if you miss these milestones, you should seek help. And so what we do mainly is that we try as much as possible to educate parents on our social media groups, and even parents we have parent-teacher relationships and therapists, so we talk about these milestones, because if you don't follow the developmental milestones, then you will miss what you have to diagnose.
So right, you've opened up a can of worms for parents, developmental milestones.
Yes.
But when it comes to treatments, there are treatments, but the bigger question is there a cure?
Yeah. And the answer is there is, at this point, there is no cure for autism, but we do have treatments. We do have treatments to help children develop the social and emotional skills. We do have treatments to help develop their language milestones. And this is the currently only proven treatment that has a long-term effect, a positive long-term effect, not just for months after starting the treatment, but into years into the development of children. And the short form is called ABA, Advanced Behavior Therapies, and they include occupational therapy, physical therapy, and speech-language therapy. It's a very specific way to teach those children, reinforce positive behaviors. And this is the only current proven therapy.
Okay. Doctor, allow me to ask something else. While you do have the early childhood or being detected at the early childhood, is there a possibility of someone maybe picking it up at later stages of life, maybe preteens or teenagers?
So autism is a spectrum. What happens sometimes is that patients go undiagnosed for some time, and at a certain time point, let's say they enter college or they enter a certain stage of school, more specific and more like deeper requirements are needed in certain areas of cognition or social functioning. And this is often when patients become apparent. It's not that the diagnosis at that time suddenly they have autism, but they had autism. They were on the autism spectrum all their lives. It just hasn't been detected, and it was not as prominent in their daily lives.
Okay.
Which I also think that we had this before, but it was never diagnosed. So we don't know. We now know about it most because it's being diagnosed at an early stage.
Okay.
Yeah, because I know so many of us who could not write and could have been on that spectrum at a certain point.
All right. So Pamela, in that regard, I know that it's the Autism Awareness Week as well as Acceptance Week, and I know that you are planning something towards the end of this week in creating more awareness against this condition.
Oh yes, on Thursday and Friday, that's 30th and 31st, we'll have a conference for everyone who would like to attend, and they could come in and learn more about autism. We shall be explaining the autism, the mind and the brain, the transitioning into adulthood and management of this. And so it would be nice, especially for people, caregivers, I'm talking about those who do therapy, and parents, because I think the parent is the
information
best
is key.
and information is key. So we've invited a number of people. We've invited the general public. We've also invited schools, because we noticed that because of the stigma, parents take their children to
special schools,
mainstream schools, and they don't get help.
Really?
Yeah, they are in the mainstream schools, and these mainstream schools
wanting to pretend that everything is okay.
Maybe they don't know. Maybe they think there's this mentality that my child will do well
if they are in a community of children. They'll pick up on these behaviors.
It's also good. They do well, but sometimes they need to be pulled out and have a one-on-one session, which actually Tunaweza does. So you have an individualized education plan that will help you cope. Because when you're in a group, you may not pick they may not know what exactly your difficult concentration won't work. So we've invited schools to also come so we can share with them the knowledge and know how to deal with such children within their schools.
Okay.
And yeah, so it's on 30th and 31st.
The place?
In Chambogo, Central Lecture Block, room 105, which can accommodate as many as we can.
And the time will be?
9 to 5 p.m.
9 to
so 5 for the 2
p.m.
days. Yes.
Okay.
Yes.
All right. Doctor, in your closing remarks, word of encouragement?
I think there's a lot of research for children with autism, and the more awareness we have, the better we can make the lives of children and their families with autism. And patients with autism, they can have a fulfilling life.
Okay. All right. Thank you so much, Doctor. Thank you so much, Pamela, for that information. I trust that it has caused your eyebrow to go like, yeah, in one way or another. This has become sort of a norm in families that you know here and there. But if there are solutions or there are places that can help, like Tunaweza, it's definitely going to go a long way in mitigating these challenges within our community so that we can have wholesome social development for our children. That brings us to the close of our Tech Dot this morning. When we return, it will be our Kickstart. Stay tuned.
You're watching